Firstly, thank you so much for this interview. We came over all the way from London to attend your nutrition and healthcare conference. It was amazing. I want to talk about that a little bit later, but first up, well done. You're featured in the film What the Health. What did you think of the film?
I think What the Health is a terrific film. It's really getting the word out to people who never thought about changing their diet before, and to realize the huge implications that a diet change can have.
A dietitian and nutritionist recently told the Daily Mail that it was one of the most poorly represented documentaries she had ever seen. Does this kind of backlash and response surprise you?
No, I think there are people who find things to criticize, and I think those people do better to have a little more fiber in their diet.
And that same article was critical of the link between diet and diabetes. They said this is distorted science. So the question I want to ask you is, does processed meat cause diabetes?
The things that cause diabetes are, if it's type 1 diabetes, which used to be called childhood onset diabetes, that's an autoimmune reaction where antibodies are destroying the insulin-producing cells. That can be triggered by dairy, perhaps. That's one of the possible culprits, maybe viruses and other things. Type 2 is more common. Maybe 90+% of diabetes cases are type 2 diabetes, and that's caused by insulin resistance, where the muscle cells or perhaps the liver cells are not taking in sugar from the blood, and then the pancreas makes more insulin to try to overcome that, and it starts wearing out, and the combination of insulin resistance and pancreatic failure, that's type 2. Now, food plays a big role in that. When people, say in Asian countries, go toward a meaty diet, having been on a more plant-oriented diet, once they get into meats and cheese and so forth, their diabetes rates go through the roof. Sugar can aid and abet that process, but there's an old sort of myth that if I got high blood sugar, meaning diabetes, that must have came because I ate sugar, and that's naive and not accurate.
So what do you say to, I'm playing devil's advocate here, because I found a lot of people watch our channel, they're not plant-based, and they're bombarded with all kinds of misinformation. Joe Rogan, for example, who's got a huge podcast, said a lot of the film is pseudoscience, and the doctors, he actually said they're lying. How do you respond to people like that, who have a huge media presence, and they've accused the people in the film of lying?
It's important to go back to what science has shown us. And in 2003, the National Institutes of Health funded our research team here to do a head-to-head test of a vegan diet. And it was a diet that was vegan, also low fat, and low glycemic index, which is not low carb, but it means that when we choose grains or starchy foods, we choose the healthiest ones. So vegan, low fat, low GI. We tested that against a more conventional diet, and the vegan diet really did great. The people did better than with the other. So that's scientific, and then there are pathological studies that look inside the human body to see what's going on with different diet changes, and we have a better idea than we ever did before.
It's like, for people that don't know, right, the NIH funding, is that essentially from the governmental institutions?
Yeah, the National Institutes of Health is the U.S. government's research funding body. It's the biggest research funder, or at least governmental research funder in the world. And it has nothing to do with industry, and it's not playing any favorites for the sugar industry or the pork industry or any of that kind of stuff. And the evidence now is overwhelming that when people who have diabetes go to a vegan diet, I mean get the animal products off their plate, and go further, keep the oils low and have it be healthy, vegetables, fruits, whole grains, beans. But when people do that, they do great. And so we do not suggest things like a low carbohydrate diet where you're not having any fruit anymore and instead you're eating greasy, meaty foods. That's really a mistake.
Can you just talk about the conflicts of interest that kind of pervade our scientific community?
Conflicts of interest are coming in like bad weather in February. I mean, it's just all the time. I'm sorry to say, you have the egg industry trying to show that cholesterol doesn't matter, and the meat industry trying to show that fat doesn't matter, and the dairy industry in particular is trying to show that dairy fat won't hurt you. They're there constantly, and they're getting smarter all the time. They fund studies of their own. They know how to put studies together that will seem to exonerate their product, and they pay medical organizations, health organizations, a certain amount of money. You don't want to call it hush money, but it's kind of what it has become. And that is not going away because the money they're talking about is measured in tens of billions of dollars.
For the people that say that sounds really conspiratorial, can you maybe provide some kind of clear, one example or a couple of examples of the conflicts of interest?
There was a study published a couple of years ago, I think it was 2012 or 2013, from Tufts University, where researchers looked at dietary cholesterol and did it affect blood cholesterol levels? Because the science has clearly shown that if you eat more cholesterol in eggs and other foods, your blood cholesterol goes up. Well, they took 12 studies and showed based on this, it didn't seem that it would go up very much, and only for certain people. When you looked at those 12 studies, 11 of them were industry funded, 10 of them were specifically the egg industry paying for them. And when we dug into the details, it looked like actually dietary cholesterol was a problem, but they had done their best to cover their tracks. So this is a problem. It pervades, and it does influence what people think and what the policies are that the government puts out, and we have to counter that with good science.
How do we counter that, though? You say good science, but how do you do that in practice?
We counter this in we counter this in a couple of ways. The first is that we do studies ourselves. And you have to do your studies honestly, where you bring in people and you change their diets and you measure what happens and you make it totally transparent and you publish the results in peer-reviewed journals, and you let other people, if they wish to replicate it and see if they find the same thing. But we go further. Then we'll do systematic reviews where you look at every single study published on a certain topic and you pull it together and you publish that too. But we also don't hesitate if other people have been somewhat less than forthright in their research. We don't hesitate to show how the research should have been done.
Great. And back to the film, Vox, who are a massive media outlet, criticised the film for suggesting that fish is toxic. The media outlet say that eating fish comes with many health benefits, such as delivering essential nutrients like omega-3 fats. How do you counter that?
Well, fish do have omega-3s in them. They get a lot of it. It's not most of the fat in fish. Most of the fat in fish is not omega-3, but fish are also one of the leading sources of mercury and PCBs and pollutants that come from the fact that they live in what has effectively become the human sewer. I'm talking about our rivers and streams and, unfortunately, the ocean. So nobody disputes that. Anybody who looks at the literature will be quite impressed by how dirty fish populations are. So there are those of us who would say you do need traces of omega-3 in your diet. If you sent a sprig of broccoli to the laboratory, they would tell you it's about 50% omega-3. I'm talking about the fat in broccoli. There's not much fat in broccoli. It's only maybe 9%, something like that, of its calories. But of that trace, a surprisingly large amount is omega-3, and you get it from green vegetables if you're eating green vegetables. If you're not, you're not getting it, but bring them into your diet in a big way, and don't eat a lot of the competing fats and oils, a lot of French fries and goo all over the place, because that ties up the enzymes that process the omega-3s into longer chains.
So you're saying this kind of rhetoric around fish being essential is misinformation?
Fish is not essential. It has never been essential. Mercury is not essential in the diet either, I might say. And fish, some people will say, well, it's better than beef, isn't it? Better in the sense that it's somewhat lower in saturated fat, but it still does have saturated fat. It has cholesterol. It has no fiber whatsoever. And epidemiologically, when you look at people who favor fish, they are slightly slimmer than the beef eaters, but they are substantially heavier and have a higher risk of diabetes compared to ovo-lacto vegetarians, and much more so compared to vegan. So some people argue going from beef to fish, good step, plus minus, hard to say, but going to a completely plant-based diet, I mean a vegan diet with no animal products, best of all.
What do you think the biggest misinformation about health is in the mainstream?
There are so many bits of misinformation that just kind of won't go away. The one that we hear about a lot in medical practice, when you're looking at your overweight patient, you're trying to help him to change his diet and think about going to a vegan diet. The first question that comes up is, where do you get your protein? Now, of course, he doesn't know what protein is. He's never been protein deficient, but he can't get the idea out of his head that there's some issue about this. And so we have to let people know that if they ate nothing but broccoli and beans and plant-based foods, they would get they get a lot of protein. They get more than their body is ever going to need. And even if they are a top-level athlete, they still get more than enough protein. So not a big issue. Calcium, can I get calcium without milk? Yeah, sure you can. The cow does not make calcium. The cow eats calcium from green leafy vegetables, grass in the cow's case, broccoli in your case, or kale or collards or Brussels sprouts. So green vegetables have calcium. You get lots, as long as you eat those healthy foods.
Let's talk about cheese. Did you read the study in the big UK outlet, The Guardian, recently? The headline saying, eating cheese does not raise the risk of heart disease. Is this true?
I am embarrassed to tell you I didn't actually read that article. However, I'm happy to talk about cheese and heart disease. Cheese is everything that was in milk that's not healthy for you is accentuated in cheese. So milk is pretty high in bad fat, saturated fat. Cheese is higher in it because it's concentrated when you make cheese. Cheese has a lot of cholesterol, as much or more than meat. It's one of the highest sodium foods. So if I take a typical serving of potato chips, which is they're pretty salty, they have 330 milligrams of sodium. If I take the same size serving of cheddar, it's got even more salt, 350. If it's Edam, it's 500. If it's the processed cheese that's popular in America, Velveeta cheese, it's 800 milligrams of sodium. Some people want to pretend that this is healthy. If it were any worse, it would be asphalt.
For people concerned about what you just said, and they're thinking, should I drink milk instead of eating cheese? What do you say?
Well, you should definitely drink milk if you are a calf who is not able to eat on his or her own. Cow's milk is what nature designed for you. And if you are a human being, you should definitely drink milk from your mother while she is breastfeeding you. But one of the rules that nature laid down for every mammalian species is that you got to get weaned at some point. And human beings being so creative, we figured out that we don't ever have to get weaned if we invent a dairy industry. But milk is not necessary, and it has a variety of harms. Number one, it comes from a pregnant cow, most cases. Dairy cows are pregnant 9 months out of every 12. They're impregnated every year. Their gestation is about 9 months. Pregnant cows make hormones, estrogens, that get into the milk, and it's only traces. But when you turn milk into cheese, it's concentrated. Your average American eats 35 pounds of it every year. And we're seeing hormone effects in men and women. Now, don't get me wrong. We need more study of this, but it is already enough for people to say it appears that these hormones may actually have biological effects in human beings.
Do we really need more studies that are showing that?
I think that we are way beyond the point of being able to conclude that people should throw away their dairy products completely, and the dairy should be used for the purpose that Mother Nature had in mind, which was nourishing the infant of that species. That's it.
A question from Dr. Martika Hina. I've seen the negative effects of trying to associate an animal rights message or agenda with the plant-based health message. Have you had issues with this?
You know, when people discover that a plant-based diet or a vegan diet, a diet based on vegetables and fruits and whole grains and beans, when they discover that's healthy, somewhere along the line, they start realizing, you know, the animals aren't having very much fun either. I mean, Americans eat 1 million animals every hour. And you don't have to spend 5 minutes in a slaughter plant to realize that it's a grotesque operation. But some people will say, wait a minute, we're afraid of talking about that because if you seem compassionate, maybe you wouldn't be a hard-edged scientist. My feeling is all of these things apply. The science is solid, that people following a vegan diet do the best when it comes to having a healthy weight, or the least risk of diabetes, or being best protected against heart disease and cancer. It's also a compassionate diet, and for me as a doctor, I value compassion in my colleagues, in the people I work with, and in patients. It's a good motivator. And it's an environmentally healthy diet too. And the reason I think that's medically important is if I'm talking to an 18-year-old guy, he is not the slightest bit worried about prostate cancer, but he might be an environmentalist or an animal guy. And if that helps him to follow a healthier diet, good on him.
Let's talk about the misinformation a little bit more. In the Guardian example that I provided earlier, which says eating cheese does not raise the risk of heart disease, there are actually a lot of conflicts of interest in terms of, they receive funding from the dairy industry. My question to you is, how do the institutions and the review boards let this happen?
Unfortunately, there is no shortage of industry money that goes to scientists who are often hungry for it. Even though the industry will say, well, we aren't going to tell you what the results ought to be, the scientists know that if there is an industry unfriendly conclusion, that they just got their last grant from that industry. So it's a huge motivator to find industry-friendly conclusions. These same industries also fund health organizations. They give a lot of money to them. And if you go to conferences of the American Diabetes Association or the Academy of Nutrition and Dietetics, you'll see fast foods and sugary beverages and all kinds of stuff paying for the conference. Is it wrong? Is it corrupt? Obviously. Will it stop? I hope so.
Who has more influence over the medical industry, in your honest opinion, the animal agricultural industries or the pharmaceutical industries?
What a great question. It's funny because the animal agriculture industries, and not just them, I mean, we can also talk about the soft drink industry, and there's a lot of devils here. They make a lot of money if people eat in an unhealthy way. And then you have the drug industry that makes a lot of money when people get sick as a result. And in fact, this is what we've seen in China. When China started to develop more wealth domestically, and they could afford to have more meat, and they could afford to have cheese and dairy, which was really not a Chinese tradition, their cardiovascular disease rates, diabetes rates, obesity rates went up through the roof. And who was waiting for it to happen? The people providing medications for cholesterol problems, for diabetes problems. They recognize the market, and they have cashed in a big way. Bad as that is, people start to recognize what this is all about. And there are more people than ever getting the animal products off their plate, going to a healthy diet. And when you go into health food stores, you see them. They're either all the way vegan, or they're having more and more of these things in their routine, and they're on their path. So the future is clearly toward a diet that is built from plants.
Great. And as we said to you at the start of the hour, we actually came here to Washington from the UK to attend the Nutrition Healthcare Conference. Why do we need that? Can you introduce that conference a little bit and talk about why we need that conference?
Sure. The science for plant-based diets, vegan diets, and other kinds of diet changes is now extremely strong. But many doctors aren't quite sure how to apply that in practice. They're not sure how to advocate it for in their community or how to talk to the individual patient about it. They weren't taught very much about it in medical school, so we need to make up for lost time. So at the International Conference on Nutrition and Medicine, we have 700 or more doctors, medical students, dietitians, nurses who come to compare notes with each other, to learn from the experts, and to get the tools that they need to be able to provide this to their patients.
And what's been the feedback?
The feedback has been overwhelmingly positive. People are so glad because, let's face it, if I'm a doctor and all I've got for diabetes treatment is medication, then I've just guaranteed my patient they will never get rid of their diabetes. The medications manage it. They're maybe better than a Band-Aid, but they don't make the disease go away. If, on the other hand, we tackle the cause of the disease, the cause of type 2 diabetes is eating habits. The cause of high cholesterol is eating habits for 90+% of people. If the physician knows how to tackle that, then you can promise the patient something you could never promise them before, which is you can improve that condition a lot, and maybe you can make it go away. So let's give the patient a chance for that. And instead of feeling like you're a pill factory, suddenly you're the patient's best advocate. So you're a doctor, you're kind of a coach, but you're really changing people's lives.
Can we have a Dr. Barnard meal plan? Like what did he eat yesterday?
Yeah, everybody can do this in their own way. I can tell you what my favorites are.
Please.
If I'm having a lunch out of the office, well, to tell you the truth, for kind of any meal, I sort of think international, which is to say I grew up in North Dakota eating roast beef, baked potatoes, and corn, not very imaginative. So for me, my lunch might be something from another culture, like Mexican food, a burrito made with beans and jalapeno peppers, and there's nothing that says it can't be a little spicy. My dinner might be an Italian pasta, but not covered with Alfredo sauce and all the cream and cheese and stuff. But it might have oyster mushrooms, or which are made not from oysters, but they're mushrooms, chunky tomato sauce, artichoke hearts, those kinds of things. If I made a pizza, it would not have the cheese on it, but it might have extra sauce and mushrooms and tomatoes and all kinds of healthy toppings. And for me as a kid, I didn't know about those healthy foods. But now that I do, I wouldn't go back to the things that I grew up with.
Great. And coming to the end now, I've got a couple more questions about What the Health, which you were featured in. Most of the articles debunking the film repeat a lot of, they report misinformed studies. Mm-hmm. Do you agree that when we're bombarded with all of this misinformation, it's easy to kind of think everything's fake news? And how do people at home that don't understand the science like you do, how do they know what's true?
It's a great question. How can a person at home know what's true? And I think it's harder and harder and harder for them to tell, because you do have industries funding research studies from otherwise reputable institutions, published in otherwise reputable journals, and they spend a lot of time also lobbying policymakers. So I'm not quite sure how a person can sort through it apart from getting to know the sources a little bit. And I'm hoping that at the Physicians Committee, people have been able to recognize that what we provide is trustworthy. And also there's something we call the Sniff Test, which is if something just doesn't smell true. Like you can eat all the sausage you want and it won't cause colon cancer, and eggs don't cause your cholesterol level to rise. I mean, those things really don't pass the Sniff Test very well.
And with What the Health, the film, do you think the controversy is good? Do you think it generates conversation, or do you think actually it's kind of negative?
I am delighted, first of all, that What the Health is out there and that people can see it and that they can talk about it. And if, for some people, if it kind of breaks their preconceived notions and they push back a little bit and they want more information, I think that's all to the good. So the more people see great new films talking about healthy diets, I think we're way ahead of the game.
And if there's one takeaway you want people to have from the film, what would it be?
I think the real takeaway from What the Health is, number one, we're talking about serious issues. Heart disease and cancer and diabetes and obesity. These are serious now. And they are deadly serious for the next generation that is growing up in the face of all kinds of unhealthy seductions that are there in the school lunch line and at stores on the way home. And to the extent that people can understand what it means to build your diet from healthy vegetables and fruits and beans and grains and to get the animal products off your plate, that's the message that we really need to take to heart. We can't wait. We learned that from smoking. The whole idea was, yeah, I know smoking causes cancer, but I'll just wait, I'll quit eventually. Well, time is now.
Quick question from Emily. I'm a low income and eating meat is cheap and more available and just more normal in my community. She's from like a Latino black community. What would be a good way to kind of convert or bring awareness to communities like mine?
There's nothing cheaper than a sack of dried beans, a sack of rice, frozen or canned vegetables, whatever it is. These things are cheap. And when you get the meat off your plate and the cheese and stuff out of your cupboard, you're going to not only be healthier, but you're going to save money too.
Can you talk about quickly the Progress PCRM, or do you like to be called the Physicians Committee now? I think you recently changed, didn't you?
Well, it's the same.
It's the same, but
we're called the Physicians Committee for Responsible Medicine, and you can shorten it as PCRM or Physicians Committee or whatever you want to call us.
What have you achieved in the last year, and looking ahead, what have you guys got on the radar?
Lots of things are happening here all the time. On a policy level, we were very successful at getting the V word into the last iteration of the dietary guidelines for Americans. They said there are 3 healthy diets: vegetarian, Mediterranean sort of vegetarian light, and healthy US, whatever that means, but we were glad to see the V word there. We have been doing some huge research studies here. We've been working with our friends at the American Medical Association to have healthier food for hospitals, healthier food in our food assistance programs. And when you look at just the bottom line, what's happening with meat consumption overall is going down, 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 down. So things are going in the right direction. A generation ago, we tackled tobacco. And the first idea was to let's get our head on straight about what tobacco does. And there was a lot of debate that people have now forgotten that does tobacco cause lung cancer or not? Well, yes, it does. Do I have to quit or can I just cut down? Gotta quit. Do I have to ban it from my restaurant, my hospital, and my airline? Yes, but there was a struggle every step of the way, and yet we won that in the sense that there is not a person on the planet who doesn't know that tobacco causes cancer. But still, a fair number of people are dealing with this in their own lives, trying to get away from it. And there is still a huge multi-billion-dollar industry finding markets. If you won't buy it in America, let's try Korea. Let's try Japan. They aren't going away. Today, that's where we are with the food industry. Let's get our head on straight about the science of it. And now, pretty much every health authority knows that people who base their diets on plants are healthier than people who don't. That's a great victory. Everybody knows you don't need meat in your diet. Everybody knows you don't need dairy. So we're coming along. But people in their own lives are thinking, gee, to what extent do I need to go all the way or can I just cut down? Those are all good stages that we are working our way through. We're in a better situation than we've ever been in, but industry isn't going away. And it's now saying, well, if you won't eat this in Chicago, let me see if I can sell it in Korea or China. That's what we're up against. So as a doctor, we've got to be vigilant. We've got to push hard. We've got to make sure that people have the tools to protect their families.
Lastly, what do you want your legacy to be?
I don't want to have a legacy because as a vegan, I'm going to live forever.
Thank you very much.
I'm kidding. I'm kidding. The point that I'm really making is there are lots of people who are doing this work. There are many, many, many people who are changing their diet themselves and finding ways to interpret this message for other people. There are businesses like Geico that we did a study with, the car insurance company that we worked with a number of years ago, and many others that are saying this is good for our employees. We have members of government who are saying, why are we supporting unhealthy foods? Let's change that. So yes, there's a lot of struggle to get every benefit, but there was never an Olympic champion who didn't struggle to get to where they are. We didn't beat tobacco without struggle. Yeah, sure. We're going to get there. We're going to win. We're already winning.
Thank you for all of your work.
Sure. Not done yet.